Was born in Connecticut and lived in housing development with my mother and my two brothers and two sisters. Single family household. Mother was a community activist. She organized tenants in the housing development where we lived and then went around the city helping to organize other tenants. And then she moved on to an organization called National Neighbors, where they were organizations from around the country. And so from there, I've always been involved in community activism. And so when I moved to Boston, I just continued that work. Worked in the community, worked on with Rosendale, Healthy Rosendale, an organization in Rosendale that has a youth group called the Rosy Reps. And the Rosy Reps are, in the past, have been 35 strong, and the young people graduate. We have a 100% graduation rate in our Rosy Reps, and they go on to, 90% of them go on to go into college. I'm past president of the Boston branch NAACP, and I was president of the organization in Boston. We worked on HIV/AIDS and teaching people of the awareness and testing and education and outreach. The branch also wrote a resolution for the 2009 National Convention, which was the year that NAACP turned 100 years old. I went to St. Francis School of Radiology Technology, and I worked at New England Medical Center for 24 years and 10 months. I was a Black Achiever at the New England Medical Center where I worked for 24 years. And so receiving the Black Achiever Award, one of your responsibilities is 40 hours of volunteer work. So I chose to work at the Hyde Park Y, and I was there for about a year and a half, did a women's exercise program for them, and then was part of their board for a number of years. And then at the same time I was working in the community with First Incorporated, which is an African American substance abuse organization, but it had African Americans, Latinos, and women, families in Roxbury. I went in as a staff technologist, and then I moved up to becoming one of two CT technologists for computerized tomography, which is called CT scanning, in the city of Boston. And then from there, I was going to school nights, and when I received my associate's degree, I moved on. I received my associate's degree, my bachelor's degree. I moved on to become a computer operator. I changed professions, and I did that for a couple of years, and then I was promoted to be computer analyst, programmer analyst, and then they promoted me to be the data center manager. So I stayed doing that for about 12 years before I moved on to IBM, Lotus IBM over in Cambridge. In that position, I was the data center manager, the corporate data center manager over in Cambridge. Then I moved over to what they call the global IGS arm, this is the outsourcing arm of the IBM Corporation, and became the data center manager, became the manager of disaster recovery for the Northeast. So I think that what most people are concerned about is healthcare and home and secure homes and job security. We need to make sure that the laws that we do have, that they're enforced and that they're not weakened, and to look at the laws better to see that we're treating everyone equally. So those are basically the issues that we're seeing here on the campaign trail. Focused on September 14th, 2010. That's the primary day. That's the day I become state representative of the 6th Suffolk District. And my focus, again, will be, once I get to Beacon Hill, is to building coalitions with the legislators up on Beacon Hill on the issues that are concerning the folks here in the 6th Suffolk. And that would be jobs first, okay, ensuring that the jobs that are created in Massachusetts come to the folks that live in the 6th Suffolk. Education. Making sure that the education reform has a positive impact on our education and our children. We have to also look at nationally, what President Obama is looking at, and re-signing the No Child Left Behind bill, and how they're going to rewrite it. We have to understand that. And healthcare. You know, healthcare. Everyone has healthcare insurance. 97% of the population in Massachusetts has healthcare insurance, but do they have access to their healthcare? So it's really, really important that, you know, because we have it, when diagnosed with a problem, can I get to the doctor to have it treated? And that's real important. If I have to go to the doctor, are the people where I'm going to be treated, are they welcoming? You know, so it's real important that not just to say that we have it, is to be able to get access to it and to benefit from it. So the time is now. Now is the time for us to step up and be present for all these discussions. We have to be present for the discussion on education. We have to be present on the discussion about healthcare, and we definitely have to be at the table when we discuss jobs and economic development.